All right. So, I just want to thank everybody for being here today. And for those of you that is your first time being here at a KFAN training, hey, I'm so glad you're here with us this morning. Um, so I want to give a little context for today. Um, so KFAN has been doing advocacy trainings every year for 4 years now, I believe. And Sheila has been so great that she did a 101 for us 3 years ago. So, but every year we've kind of built onto those advocacy trainings. And we just think this year it's time to get back to the basics and come back with a 101. And Sheila has came back with us, and she is a great human being. I'm so happy you guys will get to hear from her today. Um, so let's see here. So a little bit, I'm going to introduce myself, and then I'll turn it over to Sheila for her to start our whole training today. And I do want to say that we will have some time at the end for some questions, but me and Sheila say, conversation's best. Just raise your hand, speak out, put it in the chat. Me and Robin will be looking and monitoring the chat. So if you guys have questions, drop
Right.
them. And we want you all to be as interactive, ask as many questions as you like. Because a lot of this too is asking questions and talking it out. So, little bit about me. I'm Kimmie Ishmael. For those of you not familiar, I am a staff person for the Kentucky Food Action Network. But I am with Community Farm Alliance, and we do a lot of advocacy work and policy work around agriculture and food policy. Super excited to be here today, and I will turn it over to Sheila.
Thank you, Kimmie, and I'm delighted to be back with KFAN. I actually hear from KFAN on a weekly basis, so that's great. Um, I am a licensed psychologist, did about 30 years of practice in Louisville, seeing only kids of all ages and their families and their school people and their all of their connections. And then in 2000, I was doing a lot of advocacy work in Frankfort at the time, but I was going back and forth and trying to juggle both worlds. And I decided I was getting too old to go from the macro to the micro every day. So I've been doing full-time advocacy since 2000. So I'm the longtime chair of Kentucky Voices for Health, and I will encourage you all to sign up for their weekly newsletter because it's a great way to stay abreast of what's going on in the world of health and health related things like food security, like housing, like childcare, certainly with Medicaid and so forth. I run an organization called the Advocacy Action Network. And in the course of my discussion here, I'll talk about what we do there. And as Kimmie said, we really want this to be interactive. So don't hesitate to ask a question or comment or whatever as we go along. So I'm going to talk about why advocacy is so important, and then take you through the process of getting some policy changes done. Because I think what we all realize is that we can try to help one person at a time. And that's what I was doing in my clinical practice. And then I realized one day that I'm not going to change the world one kid at a time. I'm going to have to do something that's going to affect more lives. And you all are working in the community. You're hearing from people that have food insecurity, and you want to help that particular person, but we need to look also at what are some things we can do that might help a whole bunch of people. So next slide, please, Kimmie. So why advocacy? This is a gathering of a few people, as you can see. Sometimes we try to bring numbers. I've never been lucky enough to have these kinds of numbers. These were teachers and school personnel back in the Fletcher administration. So it goes way, way back. And there were about, I think they had 10,000 people at one point there in the Capitol. Now they have a secret weapon. They got their superintendents to call off school that day, and so they commandeered the school buses. So they came in school buses from all over the state. But it just shows you that there is power in numbers. And I'm going to talk with you about working in coalitions so you build your numbers. But there also is just immense power in a single voice. Next, please. So my definition of advocacy is that it's education with passion. And I think the thing that marks people that are really effective advocates are people that have such a passion to do this thing, to change that policy, to help those people with that particular thing, that they do all the things that you need to do. And they also do it, even though it might take a long time to get that policy changed. So one of the things we're going to talk about is that we can't expect that you're going to get it done the first time. It does happen every once in a while, and I'm always amazed and happy for people that come up with one issue and it gets done that session, but that's a rarity. I've had legislation that I have worked on for 15 years that it took to pass it. And so you have to have that passion. So you have to be somebody who listens and somebody who's willing to connect people with each other, someone who's willing to speak out and who will take action, and that you have, again, that passion about an issue or about a group of people that need something. Next, please. So this is one of my coalitions that I run. This is the 874K Disabilities Coalition. We started this in 2001, and 874K represents 874,000 plus Kentuckians who have a disability that interferes with some task of daily living. So think about that. It doesn't count kids under the age of 5 because it was done on the basis of the 2000 census, and it doesn't count people that are in institutions. So it's about 23% of our population. Actually, we probably have more if you think about kids under 5 and people with disabilities that are no longer in the community, but are being served in intermediate care facilities or in nursing homes and so forth. They're probably the largest minority group, if you will. And I have this dream of getting them all on the same page. Think about they could influence any vote that's out there. 874,000 people voting one way or the other. A lot of our work with this population of people is to convince them that they have a right to speak up and that they have a story to tell. So some of your advocacy is about helping people to find their voice, where they might say, you know, I'm poor or I'm rural or I don't speak well or nobody cares what I think or whatever. And the truth is that those voices, the people with what we call lived experience, is really some of the most powerful voices that we have. So this was back when we used to have a convention center in Frankfort, and we would have maybe 1,000 people there with disabilities meeting with their legislators. And all of the speakers, or almost all of the speakers, were people with disabilities. So you can imagine how both intimidating, but how exhilarating it was for people to be able to come and tell their story in that setting. Next, please. So this is what I call my therapy slide. So if I'm seeing you as a psychologist and you're coming in for therapy and you're telling me, oh, week after week after week about a situation that's really getting to you, but nothing ever changes and you don't ever change. And at some point, I'm probably going to say to you, you know what, you have to either decide that you're going to do something about this situation, or you're just going to have to decide that you are going to live with it. And the analogy is that Frankfurt's going to happen whether we're there or not. And what happens in Frankfurt really does affect you. And it affects you and your family. It affects the community that you're living in, the community of people that you're trying to serve. And you can close your ears and put your head in the sand and decide, you know, that it's not happening. But the fact is that it is happening. And my thing is, if we're not there to push back on it or to try to change it, then we have to just be victimized by it. And I think that's someplace that we don't want to be. So I hope that you'll choose to try to influence that system. And it doesn't mean that everything they do is bad, but they do things. They pass bills and they defeat bills, and those bills, either passed or not passed, have consequences for us. Next, please. So a reminder that legislators are elected by the people, whether you voted for your House member or your Senate member, they're still elected and they owe you some responsiveness. If you live in their district, which means you're a constituent, again, whether you voted for them or not, whether you are registered in the party that they are registered with or not, they are there to represent you. And I think that you have an obligation to let them know who you are and what your issues are. And they have an obligation to respond to you. Whether they do what you have asked them to do is a whole nother question. But at least they owe you a meeting, a reply, an acknowledgement that you are a constituent. And you are more important than I am, or anybody who's a lobbyist, anybody who's been up there for a long time, because you all as a constituent have the power to reelect your House member and your Senate member to that office, or to elect them to a different office if they choose to run for a different office, or you can throw them out of office with your vote. So constituents are highly valued by legislators and actually by the governor and people in the statewide offices like the auditor and the secretary of state. So the governor and the executive branch are also elected by us. And again, the democracy requires that we speak up as the voice of the people and that they make some response to that. The other reason to do it is that we can't hold them accountable unless we have talked to them and told them what it is that we need. They're not mind readers. We can say lots of things about them, but they really can't read our minds. And so they don't sometimes know of the issue that you know about, or they don't know about it to the extent that you know about it. And so unless you have spoken to them and said, we need to fix this, or here's a bill that will hurt people in this regard, or here's a bill that will help people, then we can't hold them accountable. Next, please. So get ready. This is my guilt slide. This is the last time I'll go after you. This is, again, one of our 1,000 people disability gatherings early in the morning over at the convention center. And we had people with disabilities sitting at tables with their legislators. So a great opportunity for them to talk to their legislators and for their legislators to have a chance to hear from them. And, my question to you is, if you know of an issue that really needs to be addressed, who understands that better than you do, and whose voice is going to be heard? Or maybe nobody's. So you got to look to your right and your left and, say, hey, is somebody going to speak up? And don't assume that it's going to be Joe over here or Susie over here. We all have to take some responsibility in terms of our civic duty, in terms of being part of the democracy, and speak up. So that's my guilt laying on you. Next, please. So here's why that voice should be yours. You understand it's about policy and not politics. And let's pause for a minute and think about how hard it's been to have what turns out to be political discussions with almost everybody, even people in your family, even close to you, people, neighbors, people at church, people wherever. And, there are many places now where people say, we're not going to talk politics. It's too disruptive. It's too angry. It's too partisan. And so what happens is the policy gets wrapped up in that. And so people get reluctant to talk about change, about bills, about legislation, about things that need to be changed, because the process is political. But we need to always make a distinction between the policy and the politics. So never hesitate to talk about the policy. What are the people's needs? And what is it that's getting in the way of those needs being served? What are the things that are making life more difficult for people that you are working with or for? You obviously care, and we talked about, you can't be an advocate without being passionate about something. I would love for you all to be as passionate about mental health as I am. But you're passionate about people being healthy, having healthy foods and so forth, and that contributes to people's mental health. There's no doubt about it. And my big thing is, let's remember that mental health is health, because it gets kind of shunted to the side sometimes. So we're all in this together. It's all about the people. You are knowledgeable about your issues, and this is hard for people to kind of grasp, acknowledge, accept, be happy about. You know more about food and food security and food needs than any legislator up there. Think about that. And you may say, I'm new at this, or I only know this piece of it, or my specialty is over here with WIC, and I really don't know the other food programs and so forth. I'm telling you, whatever you know about food and food security, you know more than 138 legislators. And you've got to be willing to share what you know. Now, I'm not telling you to go in with a high and mighty attitude to talk to legislators and say, hey, guess what? I know a whole lot more than you do. But never hesitate to talk to a legislator, because you really do. And you want to be seen as a resource by legislators. That's when you know you've really arrived. I feel like I've arrived when, and I don't know at what point. I've been going to Frankfort for 46 years, so it's hard for me to kind of think about when this happened. But at some point, legislators started reaching out to me and saying, I had a constituent that talked to me about this. What is the deal with that in mental health? Or look at this bill, Sheila, and tell me if it makes sense to you, because it's coming to my committee and I don't understand it. I don't know enough about mental health. I mean, that's the position that you want to be in, where you're seen as knowledgeable and not partisan, but honest, and that you're going to try to answer a question, or you're going to try to get the information. So what's the reason why people are reluctant to talk to their legislators? And I do this training for, you name it. I've done it for judges. I've done it for physicians. I've done it for licensed psychologists. I've done it for business people, boards of health, and so forth. And to a person, if I say, why is it that you have not talked to a legislator about your issue, about this bill, about whatever you're trying to get changed? Almost to a person, they will finally admit, I'm afraid they're going to ask me something that I'm not going to know the answer to it, which is an embarrassing situation for all of us. You're in there and you're meeting with Senator Jones, and you want Senator Jones to understand your issue and perhaps support your legislation or sponsor it or whatever your ask is. And so you're in what we call in psychology a high demand situation. And you're talking along, and your piece of this, and you've got a little handout that you're going to leave with them and so forth. And all of a sudden, Senator Jones says to you, well, what's the implications for the budget? And it throws you for a loop. You're not prepared for that. And what happens in that situation so often is that we try to pull an answer out of our left ear. Do not do that. Please do not do that. You don't want to give wrong information or misleading information. And when you answer under duress like that, that very often is what happens. Think of it as a golden opportunity. This is a second bite at the apple. Obviously, Senator Jones is interested enough to ask a question, and you have an opportunity to say to Senator Jones, you know what? That's a great question, and I don't know that answer. I don't have it with me. Let me get it for you. Let me do the research and get it for you. What's the best way for me to get that information back to you? And this is your opportunity to establish a working relationship with Senator Jones. And he says, well, for gosh sakes, don't use the LRC email address because it gets so bollocksed up with stuff. Here's a different email address where you can send it to me. You're a constituent, and I think we're going to be talking often. Here's my cell phone number. You can text me and tell me that you got this information. Here's somebody in my office. I've got an intern working with me, and here's that email address. Get that information to them, whatever it is. Don't leave without a way of saying, you asked me a good question. How do I get the answer back to you? And then for gosh sake, do your homework, try to find the answer or try to find something that's a good approximation and get it back to them. But you are then working on a relationship. You're establishing a working relationship with that legislator. And it gets you over that hump of, oh, I don't want to ever talk to them because they might ask me. Quite frankly, I have never been in a session that I haven't been asked at least one, if not two or three questions by legislators. Sometimes I think they make up hard questions for me because they're so used to seeing me up there. But anyway, and I'm like, okay, I'm going to take that as a challenge and I'll try to get an answer for them. Think about the free media. I've never had the ability to work with a group that had enough money to buy media, that had a PR firm and that kind of thing. So think about keeping your issue alive, educating other people about it, having the legislators see that this is an issue that the media has picked up on. And the media will want to have two things. One, they'll want to know the facts about it, what the issue is, but they want to know who's being affected by it. They're going to, when they write it up in the newspaper or they have a story on television or they're interviewing somebody on the radio, whatever that social media, or they're posting something on Facebook about it, they're not going to talk about the ins and outs of SNAP and the changes that are coming down from CMS and that kind of thing, right? Or the ag department. They want to know how Susie Jones and her family are going to put food on the table if this change is made. And that's where you come in with your community connections and work with them. Over at KBH, we have a whole team, Holly Hudnall and our videographer, Sean, and we work with people to tell their story, to make little videos or to be prepared to talk to the media. But that's what you want to do. You want to put that face on the problem so that you can work with the media. And you want to rally grassroots support, which means that you need to reach out to more people that might be affected by this issue so that they're willing to talk to their legislator to say, I've got that problem too. And instead of just Susie and Jimmy over here, you've got 10 people saying that to the same legislator. You want to engage in coalitions, and we'll talk more about that, but I really think that's a key. And you all have a coalition. That's so neat. You've brought together the organizations and the people that care about food security, and you've created KFAN, just like we created Kentucky Voices for Health, or I created the 874K Disabilities Coalition, or my Mental Health Coalition. So the more people from different walks of life, from different perspectives, from different areas of the state that are saying the same thing to legislators, the more powerful your message is. And then obviously you have to be willing to speak up. Next, please, Kimmie. So obviously being an advocate means that you vote and you speak out and then you influence others. I'm disappointed in a lot of ways about last Tuesday's election results. But one of the things that's coming to light is that so many Americans did not vote. There are fewer people that voted, at least for the president, than we had 4 years ago. And that's really of concern. If people are not exercising their democratic civic duty, I think that's really an issue that we've got to look at. And there again, people feel like their vote doesn't count. Look at some of the House races in Kentucky that are being settled, won by 30 votes up in northern Kentucky, to replace Representative Roberts, who is retiring. I think Sheila Stevenson, who was the leading Democrat or one of the leaders of Democrats in the House, lost by 100 and some odd votes. I mean, there are some really close elections, so those single votes really do make a difference. Next, please. So we're going to talk about the process of policy making because I think it's really helpful for you to be reminded, because you probably got this in civics back in whatever, middle school or high school or whatever, or you listened to Schoolhouse Rock or, one of those things. And I'm just going to remind you of the process because it really helps when you get an advocacy notice to remember that a bill has to pass in both chambers. And so the bill is introduced and it gets a House bill or a Senate bill number. And sometimes the advocacy is, contact the senators on the Education Committee and you want to reach out to your House member. And so you reach out to your House member and they usually will say something to you like, do we have that bill? Now, they're not trying to play games with you. What they're really saying is, I can't do anything about it, about a Senate bill, until the Senate has done something with it. And if they pass it, then it will come over to the House. And then I will talk to you about whether I'm going to, vote for it or not. But you don't want to be asking people to do things that they literally can't do because the process has not reached them yet. So you can identify your policymakers, and I have the website for the Legislative Research Commission. One of the things you have to do as an advocate, and this is something your coalition will decide on, if you're trying to change policy by starting a piece of legislation, we always want to accomplish the most that we possibly can, and there's always a question about how much you're going to go for immediately and how much should be a long-term goal. And those are tough decisions sometimes to make, but going into a short session, which is what we're going to do in 2025, you want to probably keep your ask more limited because the time frame is shorter. If you're coming with a new policy, a new bill, it's really tough to get that passed in a short session because you can't afford a single delay or a single missed committee meeting. So you may want to use the short session to educate legislators and then come back the next year in a long session, which is 60 days to actually push for its passage. Again, you want to know those timeframes. You want to get as many people on your side, whether that's in a formal coalition or whether it's spreading the word or just educating people about what the issue is. And some of our biggest victories are actually killing bad bills. When I do a different presentation, I take people through the last session, 2024, and I have about a half a slide of good bills that passed. And then I have like 3 slides chock full of bills that were ugly. We call it the good, the bad, and the ugly. And there were a lot of ugly bills. And some of them passed, but a lot of them we stopped. And those are notches on your belt. I mean, those are big victories. So that's the way you protect people as well. And remember, it's all about relationships. We were talking basketball earlier, and when John Calipari was still at UK, I used to always say it's not a one and done. That was John Calipari's thing. It's not going to a legislator saying, please vote for this, and then he never sees you again. These are working relationships. Next, please. So one of the things you have to decide, we're going to talk about state legislation, but some issues can be solved at the individual level. You do some casework with somebody, you get them connected with whoever they need to get connected to, and their problem is solved. Some of them can be solved at a community or local level. So I've worked with groups for years that have tried to get a statewide smoke-free ban, because we know that so many people suffer the consequences of almost like they were smokers, except they're not, because they work in situations where people are allowed to smoke or the patrons are allowed to smoke. And we've tried for years to get a statewide one. In Kentucky, it's likely never going to happen. And I hardly ever say never, but that's one that I would put in the way distant future. So what happens is that, and this came out of the UK Center for Smoke-Free Policy, they started getting local ordinances passed. And they're now, I think, about a half of the Kentucky population lives in communities that are free of smoke-free in the workplaces and so forth. So that's another way to go about this. Statewide policy is the easiest, obviously, to take care of all Kentucky communities. And then there are some things I know that you all worry a lot and try to lobby, advocate at the national level for policies around the Farm Bill, for instance, is a biggie. So those are things that are going to come down. And I think one of the issues with the election results is that we're all kind of holding our breath, wondering what the impacts are going to be, the changes in federal policy that affect funding at the state level, that affect policy at the state level. Articulate the policy, who has the power to change it, and then figuring out who those policymakers listen to. And sometimes it's local folks. Turns out that your neighbor went to school with Senator so-and-so. Use that opportunity. So you want to take advantage of that. And you want to become one of those persons, some of those people that they listen to. Next, please. So the most powerful statement you can make to an elected official is, I'm your constituent and I vote. And again, that's because you have the power to keep them in office or to boot them out of office. It also is very effective, and it probably, I'm trying to think, in the healthcare world, it's a lot easier to talk about. I'm a psychologist and I work at 7 County Services, the Community Mental Health Center. So while I'm not your constituent, Senator Jones, I work with your constituents in providing these services. So you all can look at that in terms of food banks or in terms of the outreach of your organization and say, well, I don't live in your district. I know I work with your constituents. Identify them again. You can identify a lot by watching on KET and on the YouTube, LRC YouTube, the committee meetings. When I first went to Frankfort for real back in the 80s, I used to just go and sit and watch committees that I knew I was going to have a bill in, just to try to figure out who the real power was. So there's the chair who calls the bills and so forth, but you look for the ones where they're looking to see, what so-and-so is going to say, and they don't speak up all the time, but they're the people that you need to pay attention to. What's happening here? Okay, now go next one. Yeah, one more. We're ready to move on. Okay, it's a process. I've told you that, not a one and done. How about the next one? So written material is important. KBH, when we first got started, used to do these beautiful policy briefs. We hired a guy named Bob Gray who had worked in the AG's office and worked at LRC, and he did a beautiful job, and they had lots of graphs and all kinds of great information, and they were 10 to 12 pages long. And we had them on why we should expand Medicaid and why we should raise the cigarette excise tax to reduce smoking and, those kinds of big picture issues. And we were very proud of them until we realized that nobody was reading them. Maybe some staff, but I think that, the policymakers just didn't have time. So what I say now is, and this is a good homework assignment for you when you're thinking about, we need to do something about X, and you try to figure out what are the 3 key points or maybe 4 key points that we would need to make. What's the problem? Who's it affecting? What's a possible solution? Why would that be effective? Boom. Can you do that and put it on a single sheet of paper, one side, with leaving some white space? Maybe putting a graph or a picture or something that catches attention if you have enough money to use colored font, those kinds of things. you need to write it at a 6th grade reading level. And that's not to say that legislators are not educated beyond 6th grade, but they have limited time and limited mental capacity to take in all of the things. I mean, they're going to look in a last session, they looked at over 1,200 bills, and some of those bills were massive and very complicated. And they're trying to take in all this information. So when you want to catch their attention and give them something they can kind of hang on to, oh, that issue, yeah, I remember that. That's what you need to do. Scripts are important because when we send out action alerts and we want people to call the message line, we want everyone to be saying the same thing. In mental health, it's very complicated sometimes for people to understand what the issue is, what we're saying. And so I literally send out, here's the 2 sentences to say when you call the message line, because I want all those legislators to hear the same thing. And I want the one legislator who may be chair of the committee to hear it consistently across the board. So there's no confusion about what we're saying. And again, those fact sheets are really great, but be sure you have your contact information on them. I've been in legislators' offices at 6 o'clock at the end of the day, and they're cleaning off their desk and they pick up something and they say, this is really good information, but I don't remember who gave it to me, and there's no name and no contact information on it. So staple at the least, staple your business card to it, but at the very bottom, put your name and your email address and your cell phone and your organization on it. Next, please. So coalition, again, coalitions are really important, and they can be formalized. I don't know how formal KFAN is. My Kentucky Mental Health Coalition, which is 80 organizations and is 42 years old. We have bylaws, we have dues, we have officers, because we've been doing this for a long time. Other coalitions are could be one issue. They pop up in Frankfort all the time. A bill comes and suddenly all of us are concerned about it. And so we start meeting regularly and we say, okay, we're all going to work to fight back House Bill 367, which would have done great damage to the SNAP program and free and reduced lunch and so forth. And so I don't know that we ever gave ourselves a name, but we knew who we were. And you want to focus on those ultimate decision makers. And you want to keep a buzz going. So again, the media is really important. You want to keep that issue out there, and we'll talk about some ways to do that as well. Next, please, Kimmie. So I love coalitions. I used to be the mother of all coalitions, and now I'm the grandmother. Not the great grandmother yet, but so why are coalitions so great? Because everybody is saying the same thing and aiming at the same target. And one of the great things about coalition is that it gives you an opportunity to educate other people about the issue. So one of the big, huge successes that mental health had was in 2000, when a little band of mental health professionals and consumers and family members, NAMI and those groups came together, and we took on every insurance company in the state. And insurance companies have a lot of money and a lot of power and a lot of attorneys and a lot of lobbyists and so forth. So here was our little band. This was the original David and Goliath. And I happened to be in a meeting in the governor's office with a whole bunch of people about something else. And I said something about the fact that insurers discriminated against people with mental illness. And people are like, what do you mean? And I said, well, they charge higher copays, and there's higher deductibles for behavioral health services, and there's lower lifetime limits, and they limit the number of sessions and the number of days in the hospital and so forth. And I said, it's because they take advantage of stigma. People are reluctant to say, I have a mental illness, or someone in my family does, or we have addiction in our family. And so we formed this Partners for Parity coalition, and the most probably effective advocates in that coalition was the faith community. So we had the Council of Churches and the Catholic Conference and the Council of Jewish Women and all of these faith leaders and signed on and, talked about it from the pulpit or in the synagogue or so forth. And I had legislators coming up and saying, what's the deal? My minister talked to me about this. What's the connection with mental health? And I said, it's a social justice issue. The insurers are discriminating against people who have a brain disorder, and they're taking advantage of the stigma, and they're not treating them well. And we got a lot of support using that, and it was true. And we had a huge button. I didn't arrange it, but we were lucky. Our bill number was House Bill 268. And so we had a huge button that said House Bill 268, do not discriminate. And so we had lots of people come up and say, who's discriminating? Because the legislators don't like that, whether they sometimes pass things that are discriminatory or not. And we'd say, those darn insurers are doing that. So think about the unlikely help that you might get from unlikely partners. Here's another example. We worked for years to try to expunge the record of people that had served time for marijuana possession, which, used to be a huge crackdown, but has not. And people had served their time and so forth, but they couldn't get hired. They couldn't get Section 8 housing. And so we working on this and really not getting very far. And a couple of sessions ago, guess who joined the coalition to work on that? The Kentucky Chamber of Commerce, one of the most powerful outfits in Frankfort, because job growth and economic development and all that stuff, the business community are just high on legislators' lists. And they did it because they're worried about workforce, and they wanted to get these people into the workforce. So they weren't doing it for the same reason I was doing it, as part of a person's recovery per se, but it was the same goal, and we were happy to have them in. And it was very helpful. So think outside the box. Next, please. So the other thing you want to do, besides having your data and making sure that you have the policy down, is you want to put a face on the problem. And the more you have personal stories to go along with your data, the more powerful it is. And I will tell you, and you all probably will remember this, that we remember stories a whole lot easier than we remember the data. So one of the things, besides, getting a video made or, with people telling their story, what we've started suggesting to people, and it's been very effective, if you are going to Frankfort and you have a meeting with a legislator and somebody in their district who is a really good example of what's happening, what's gone wrong with this lack of policy, or the policy has gone wrong, and they can't get to Frankfort, which so often happens, go over there and talk to them and ask them if they will record a short message to your senator on your cell phone. And then when you're meeting with Senator Jones, you could say, a constituent of yours, Mrs. Smith, who lives on Garden Drive, really wanted to come, but she didn't have transportation and couldn't get here, but she recorded a brief message to you, and I want to play it for you. So it makes that personal connection. It really makes it a personal ask. And it's, we try to get the testimony from people with lived experience and not from the experts always. Next, please. So you can do rallies and press conferences and use social media. A lot of the legislators are on social media. You can follow them on Twitter or X, whatever it's called now, and find out all kinds of stuff about them. Whether you want to find out all that stuff or not remains to be seen. Personal visits. When we were doing the mental health work, we picked red as our color because it's the color of heart and hope and health and so forth. And really because it's so dreary in Frankfort in the winter. And so we always were dressed in red. I'd still have a closet full of red outfits and so forth. But I would go up to legislators who happened to have a red tie on and thank them for their support of mental health. And they would kind of look at me and go, what? I'd say, red is our color. So if I told you about House Bill 268 or whatever, I mean, um, so another idea, and utilize the media as much as you can. Next. So op-eds and letters to the editor can be very effective. We use them a lot in our campaign to defeat Constitutional Amendment number 2, which would have taken money out of public schools and given it to private schools. My granddaughter and I, she's a senior here at Manual High School in their journalism and communication magnet. We co-authored an op-ed that was published in the Herald Leader about the negative impact on students with disabilities. And so that whole student voice team, they call it, they're the journalists, the high school journalists across the state, wrote a number of op-eds in their local papers, and they were very effective. Remember your weekly community papers also, and again, written communications, again, using that consistent messaging can be very effective. Next, Kimmie. So I put this in here because what I hear a lot from people in rural Kentucky is, well, nobody thinks about us. Rural Kentucky doesn't have any power. We do the Thrive Kentucky Roadshow, and we go all over Kentucky, and we hear that a lot outside of the Golden Triangle. If you look at the leadership of the Republican Party, which has the supermajority in the House and Senate, and you look at who their leaders are in both the House and the Senate, probably 75% of them are from rural Kentucky. Think about that. The other advantage, actually, that I think rural Kentucky has, if you're an advocate for rural Kentucky, is you probably know your local elected officials much better than I do here in living in Louisville. I happen to know the mayor, but that was happenstance. It's really tough to get in and get to know the mayor or all the Metro Council members and so forth. So think about this. Your legislators are very connected to your local elected leaders, particularly if they're in the same party. So they're going to know your mayor. They're going to know your superintendent of schools. Are very powerful people in rural communities. They're going to know your council people, city council people, and so forth. And if you can get some support at the local level from those folks, you can make some great connections back with your legislators. So don't dismay if you're from rural Kentucky. Next, please. So I'm going to go through this very quickly because some of you already know this, but the reason I'm doing it is so that, again, it makes some sense when we talk about where we are in the process. And it's the cognitive psychologist in me. I always feel like people are more likely to act if they know more about what's going on than if they're just kind of blindly following whatever an email tells you to do. So let's go with this first thing. So again, our issues, there's nothing partisan about food. Keep telling yourselves that. There is nothing partisan about food. It's the process that is partisan. So again, the party that holds the majority, and we're talking now only about the legislative branch, holds the power, and the leadership, the people that are the Speaker of the House and the Speaker pro tem and the majority floor leader, and those are the people in leadership in the House and the Senate. But every legislator has a vote and a voice, and the Democrats, although they're in a tiny minority, have learned to work across the aisle very well. So do not despair if your senator and or a House member are Democrats. Next. So we have 38 members. This is after the election last Tuesday, 31 Republicans and 7 Democrats. And we have 6 new senators. Actually, 4 of them are brand new. 2 of them are members of the House. So they have been in the legislature and they have moved over to the Senate. So that's Steve Rawlings from Northern Kentucky and Keturah Herron from Louisville. So 6 new senators, but actually 4 who are brand new to the legislature. 80 Republicans and 20 Democrats, and 16 new members. One of them is a returning member, Representative Mary Lou Marzian, who was in the legislature for 20 plus years and sat out to allow a younger Democrat to, when they got redistricted, not to run against her. And then Josie Raymond decided to run for Metro Council. So Mary Lou threw her hat back in the ring and won easily. So she's a returning person. The numbers, the 31-7 and the 80-20, there were some changes in the House. One Democratic seat flipped to Republican and one Republican seat flipped to Democrat, but the end result was the same. So I look at this and I think, oh, darn. I've got 4 in the Senate and 15 in the House. So I've got 19 people to educate about mental health between now and January 7th, which is a lot. So good that we have a coalition of people that will reach out and do that. So think about, your first task in your KFAN or in your individual organizations is to look at those new members and make sure that they begin to know you and your organization and what the food issues are coming into the session. Next. So we're going into a 30-day session. They will go up for 4 days and they'll introduce bills. They'll get their committee assignments. The House and Senate Republicans will already have had their leadership races, but the Democrats may wait until they're in session. And the 30-day session is very odd, not only an odd year, but just odd. So they work for 4 days and they get all tuckered out and they go home for a month. They literally go home from January 11th to February 4th. So that is the greatest time in the world for you to be in touch with your legislators. Think about this. You now know what committees they're going to be on, which is really important. You want to look at people that are on A&R. You want to look at people that are on the Ag Committee. So you look at the committees that you most often work with. And even the brand new ones look a little bit less like a deer caught in the headlights. So that's helpful. So they come back and then they go until March 30th. And we'll talk about some of these processes as we go along. Next, please, Kimmie. And how are we on time? Are we running out?
You have a little over 15 minutes left.
Okay, I got to talk fast. Okay, so you can only make law when they're in session. That's the important thing to remember. The other thing is that the process is the same whether the bill is 1 sentence long or whether it's 150 pages long. So I love it when people say to me, Sheila, no problem. This is a simple little bill. And I always say, guess what? It's the same process. You still have to go through the committee hearings and you still have to hold your breath and you still have to do X, Y, and Z. So next. So they meet every year. We used to meet only 60 days every 2 years until 2001. And that was the first session that we had a short session and we went to annual sessions. So last session, which was 2024, we had a 60-day session with the budget. The one coming up is an odd numbered year. And so the session will be 30 days. And we still have the potential for the governor to call a special session if necessary. Next. So this past session, there were 1,220 bills filed. 223 became law. The governor, and you remember that the governor is Democratic and the legislature is basically Republican. So there's a lot of angst, a lot of disagreement between the two branches of government. So the only power really that the governor has in terms of the legislature is that he can veto bills. Kentucky is a very easy state to overturn vetoes because it just takes a 51% majority in the House and Senate. So all of his vetoes were overridden. the most important website for you all is this legislature.ky.gov, because you can find out just about anything you want to know. When I first started working in the legislature, my first session was 78, and then every session after that, the only way you could find out what a bill said was either to drive to Frankfort to pick it up and pay 10 cents a page, or to have them fax it to you at 25 cents a page. I mean, there was no internet. And so, you know, you had no way, or they would have a newspaper and you could pay to have the daily log, but it doesn't give the actual content of the bill. So it was hard to do business back in that day. I mean, you literally had to go to Frankfurt. So we know that 2024 was an election year, and we've talked about, that the percentages stayed the same. Next. So the 2025 session, we talked about the break while they're so tuckered out that they have to get their strength back. The legislators, unfortunately, are making the process less transparent year after year. So one of the things they stopped doing 2 sessions ago, maybe 3 sessions ago, they stopped filing what they called pre-filed bills, which means that we could see what they were working on and what they were going to plan to file in the session. So there's going to be great surprise on January 7th when they come in, and I think we're going to see several hundred bills dropped, and there we're going to be. I tried to talk about some of the things that we think are going to be there. One is a bill to establish birthing centers in Kentucky. We're one of, I think, 5 states that doesn't have birthing centers. And we think it will go a long way toward addressing some health disparities. It will also give moms a choice between being in a hospital and perhaps having more medical treatment than they might want, and having a baby at home, which is what their choices are now. We think that the House Bill 367, which was an attack on SNAP and free and reduced lunch and senior meals, is going to come back. So you all need to obviously be aware of that, which I know your leadership already is. I think we will see more attacks on diversity, equity, and inclusion on campuses, and we've seen UK and maybe NKU already kind of capitulate and say that they are disbanding their DEI offices. There's some talk about going after DEI efforts at the secondary level, high school, middle school. Some of us providers are trying to limit the insurer's use of something called prior authorization, which is their way of denying services to people, so that a psychiatrist says, this person with schizophrenia really needs this drug, even though it's an expensive drug, and they deny it and say you have to do cheaper, older drugs. You get denied surgery until you've had so many sessions of PT, that kind of thing. If I were still in practice and I did a diagnosis and then I wanted to have 10 sessions of outpatient therapy, they would say, well, we're going to approve you for 3, and then you've got to come back and do all this paperwork to get another 3, and do all this paperwork to do another 3 after that. So it really has a dampening effect on providers, as you can imagine, because it's very laborious to go through that process. And then we have been supportive of, and gun control is not, it's more getting access to guns for people that are in crisis, that may use them for suicide or for other uses, out of their hands. So they're called red flag laws in some states. Ours is called CAR, CARR. It's crisis aversion rights retention, and it would allow the police to confiscate guns upon the complaint of a family member or somebody was in crisis and threatening to either do suicide or hurt people, and a very quick hearing in front of a judge. And holding on to the guns until the person has either shown that they are back in control of themselves. Obviously, access to guns is the most lethal means of committing suicide. And Kentucky has really high suicide rates, and most of them are done with guns. Next, please. So just a reminder, I say this to myself all the time driving from Louisville to Frankfort. It's not a logical and rational process. And also those who love sausage and the law should watch Neither Being Made. So you can have good sausage and we do have good law, but sometimes the process is a little bit bloody. Next, please. So one of the important thing here is that you pick a sponsor. If that sponsor is a House member, then your bill is going to have an HB House bill number. If your sponsor is a senator and it's introduced in the Senate, then it's going to have an SB number. The important thing to remember is regardless of where your bill is in the process, its number stays the same. So what people get confused about is that we have House Bill 123 and it's about mental health coverage and insurance, and it passes the House, and then we say it's over in the Senate Health Services Committee, and people assume that it now is Senate Bill 123. Well, it still is House Bill 123. Senate Bill 123 may be pig farming, and so you don't want people to get confused about that. So remembering the number. The other thing is when you call the message line, if you just say, "Oh, I want Senator so and so to vote in favor of the mental health bill." Well, there may be 50 bills that roughly are mental health bills. So again, knowing the number is really important. Next, Kimmie. So it gets assigned to a committee. The biggest error that you can make, and that's how I cut my teeth in Frankfort. I went and I didn't know who I was talking to, and everybody who was against the bill I was there to testify for knew all the senators, and I got skunked. I don't think I had a single yes vote on my bill because I didn't know what I was doing. So I never made that mistake again. So you really need to talk to the committee members before they have a vote and before you go and testify. Next, and I think there's others on committees too. So they're supposed to be open to the public. Yes, sometimes they meet in the back of the chamber and they're not open to the public. So there's all kinds of things like that happen. But basically you want your bill to get, if you're for it, obviously you want it to be passed by the committee so it can continue in the process. If you're against it, then you are going to try to testify in the committee about why they should not pass it. Next. We already talked about that. So it goes to the floor of the House or the floor of the Senate and gets a first reading. It's published in the record. And they do that so that the legislators who are not on that committee will know that this bill is coming. So it's really important because in the Senate, there may only be 10 senators that know anything about this bill. And yet all 38 are going to be asked to vote on it. So having a day of reading, actually several days of readings are important. Next. So the second reading happens the next day and then floor amendments might be filed. The Rules Committee, which is made up of the leadership of the Republicans in the House and Senate, sometimes will delay sending the bill to the floor if there's a lot of controversy. Occasionally, they will decide on their own that the bill's not ever going to get heard, and they send it to what we call a graveyard committee or cemetery committee, which usually in the House is the A&R committee, and the Senate is the Judiciary Committee. And so it's really a bad sign if they've sent your bill back to a different committee for something to happen. Next. So you hope that it gets to the third reading. One of the most anxiety producing times if you're a lobbyist as I am or an advocate, you're sitting up in the gallery. There are unfriendly amendments. You've tried to brief your sponsor about all the ways to fight back against them. And what you really want is the old fashioned, tin can with the line and holding it up to their ear so you could whisper in their ear to tell them, no, don't say that, say this, or float a little airplane down with a note so you pray a lot and hope that you get your bill passed. Next. And then you get to do it again. So the Schuster rule is you celebrate every good thing that happens to your bill. So when your bill gets filed, you have a little celebration. If it gets assigned to the committee you want, you have another celebration. You have a really nice celebration when it passes the committee. And then when it passes the first chamber, you are, having a party. And a lot of people forget that you got to go over there and do the same gosh darn thing over in the other. So you got to pay attention. Next. So here's one of the ways that you can lose your bill, and this has happened to me and it's very painful. So House Bill 123 comes out of the House and it goes to the Senate, and in the Senate committee or with an amendment, the content gets changed somewhat. And it may even be just one word gets changed. So they passed House Bill 123. So now you have two different versions of House Bill 123. And you've got to reconcile that. And that's where this process comes in what we call concurrence, or I call it the mother may I. Because what they do is that they take the Senate then say was the last one. So they've passed it and they send it back to the House and they say, you know what, we fixed your bill, we made it better. So will you agree with the changes that we made? Well, most often since it started in the House, they say no and hell no. And they say no, and they send it back over to the Senate and they say, will you back off the changes you made? And the Senate always thinks they're smarter than the House anyway. So they say no and hell no. And then they appoint a conference committee, which is, they meet for 2 seconds in the back of the chamber and they say, oh, guess what? We can't agree. And then they appoint what they call a free conference committee. And this is really high anxiety time because literally this committee of people behind closed doors, not in the view of the public, and nobody's in there but the committee members or the conference members, can literally rewrite that bill. They can change it in any way they want. So you have the House and Senate leadership appoints pro and con people. There's a couple of Democrats, but mostly Republicans. And you send your bill in and you talk to your sponsor and the other people on the conference committee that are supportive, and you say, here's the bottom line. Absolutely, we can't live with X, Y, and Z. And I did have a bill where it came out of the free conference committee, and by gosh, they had put X, Y, and Z in there. And so we killed it. We did not accept the conference committee report, which is really hard to go back to your people and say, guess what? Both the House and the Senate passed our bill, but it's dead. So hopefully that doesn't happen. Hopefully you come out with, an agreement. And then next slide, Kimmie, it goes over to the governor. And the governor can actually turn his head and let it become law without his signature, which is kind of his way of holding his nose and saying, I really don't like it, but it's not worth vetoing. Or he can veto it, and there's always a message with the veto. And again, easy to override that. Or he can sign it and it becomes law. And he has 10 days, excluding Sundays, to do that. Next, please. So most bills become law in 90 days. If it has an emergency clause, it becomes law immediately upon the governor's signature. So you need to look for that. Next. So lots of ways for your voice to be heard. Really important to use that message line. And I've talked about it a little bit. Spread that word. Get lots and lots of people calling, again, with the same message. And they can call often during the session. It's open from 7 a.m. to 11 p.m. And I don't know what kind of medication they give those switchboard operators, but they are uniformly the most pleasant, nicest people in the world. And they will hold your hand if you've never called before and help you, get registered and get all this done. So every one of those calls generates what they call a green slip on the desk of the legislators. Next. Yes, the nicest people even. So really important to stay. It's a lot to follow. So you've got KFAN, which is wonderful. You've got Kentucky Voices for Health. You've got other organizations that you work with that you're in coalition with. So the 3 P's are be positive, be polite, but for God's sake, be persistent. Here's my thing. When I spent 15 years passing this bill, which would exempt people with severe mental illness from the death penalty, after about the 5th or 6th or 7th or 8th session, people started saying, let's just give up on it. And I said, what's the message? That it's not important to protect people with severe mental illness from the death penalty when they probably were not in their right mind when they committed whatever this heinous crime was. I said, I'm not gonna give them that message. And we actually got some legislators who swore to me that they would never vote for this bill, and they voted for it. We finally got it passed. I think they took pity on me. I don't care why they voted for it. Quite frankly, I just wanted it because it was important. Remember again that all politics are local. Be nice to your legislators, even if they're not always nice to you, even if they don't do what you ask them to do. None of them are getting fabulously wealthy doing this, at least not the legislative part of it. So if they set up a meeting with you in Frankfort or in the at home and so forth, my hallmark is that I send them a handwritten thank you note, because I think it's really important to say, you took some time for me, I'm going to take some time for you. Reach out and educate others that can help, and believe that your voice can really make a difference, because it absolutely can. And I think we're at the end. Oh, you
Yeah,
added
so
time,
I
so
just
that's
put this.
fine.
Yeah, no, I put this little slide in here and then I was going to give you the last slide, but this is a lot of you are already with KFAN, but here are just reminders of our working groups that we have for you to be able to start doing your Advocacy 101 with us. And these are this is one of my favorite quotes, and I'll let Sheila say it.
Yes, so I think the group that has been in Advocacy 101 today is probably one of those small groups of thoughtful people. And it is my favorite quote. I use it always when I talk to people, because you really do have a voice. And I can regale you with stories. We don't have time. I talked to 2 different public health classes yesterday at UK, and I ended up telling a bunch of these stories of people, just ordinary Kentuckians, who got involved, and their voice literally got the vote that we needed to get out of committee or to get it heard in the Senate or whatever. And it happens all the time, so people don't ever let somebody tell you that your voice doesn't make a difference. So I don't know that we had lots of things in the chat.
I didn't really see any questions,
Okay.
but I do have one. If nobody else has one, I do want to make space for members to ask first.
Gosh, I
So you
said everything that people needed to hear.
there was a lot in here, all good
There
stuff.
is a lot, and it's probably too much, but you know what, Robin, I try to winnow it down, and then I think, oh, well, that's really important to say. Anyway.
Yeah.
Every time.
Sometimes it's hard to put things in an hour.
Yeah.
Well, I was just curious, since you've done so much coalition building, and I think it's really one of the strategies that I think is super effective for any kind of issue. What is a major struggle you've had in working with coalitions, and how do you overcome that?
Probably for coalitions that are kind of ongoing, I would say the major struggle, I used to say some of my gray hairs from running the mental health coalition for 42 years. A lot of times you're bringing together people that aren't natural working partners in coalition. In other words, there are, certain provider groups that don't always get along with each other. There's, every time you do something involving money, it can blow up a coalition and so forth. And so one of the strategies that I employ and have with the Mental Health Coalition, for instance, is to say, the Mental Health Coalition is not going to take positions on whether any group should be licensed or not, which is a big issue for us. or on whether any group should be reimbursed or not. So we just take some things off the table, and it allows more people to feel like they can come together and come up with things. And we don't necessarily, depending on the size of your coalition, when you have an 80-member coalition like I do in the mental health coalition, and a lot of times multiple people from the same organization, we don't put things to a vote all that often. So we actually work on a kind of informal consensus model when we come up with our legislative priorities and so forth, and people, have every opportunity to weigh in and ask questions and so forth. But it kind of gives us some guidelines for what we want to support or not. And there are people, so actually it's in our bylaws that any group can take a different position from the coalition, and that we have occasionally had, an organization that wanted to oppose the bill and the rest of the coalition didn't, or whatever. And so the rule is you can do that, but you cannot say that you're representing the mental health coalition in your opposition. So I can say, the Kentucky Psychological Association, for instance, because I was their rep for the longest time, is opposed to this bill for these reasons. And, but I'm not saying that it was the entire coalition. So that's a kind of inside politics, and that means that you're working with maybe a lot of not natural partners. The other thing is that in coalitions, there's often an unevenness or a discrepancy in how much some members know about an issue and how much other members know about an issue. And so I think you have to be really careful not to use a lot of jargon when you're talking with your group about why this is an important issue or what position you're going to take. Just like you don't want to do that with legislators. So it's a good reason to not be using a lot of jargon and a lot of acronyms and that kind of thing. And I think that because somebody's in a coalition doesn't mean that they have the same background or the same knowledge base, in a sense. So, and we, quite frankly, we have a lot of consumer groups. And so you have people that have lived experience with addictions or mental health issues, and they're at a different place in terms of how they've experienced the services or the lack of services. And that input is extremely helpful. But when it gets to the technicality of how you go about talking about the policy, you want to be real careful that you're not talking over people's heads or, making them feel like they don't have a role. Does that make sense?
Yeah, that's all really helpful. Thank you.
Sure. And good luck.
Thank you.
No,
What
I think people are more likely to act when they feel like they're part of a group that's taking action. That's the other reason to have a coalition. And particularly if you have some really enthusiastic folks who kind of say, come on, I know you haven't been to Frankfort before, but come along with me and, let's go experience this. And you can see what it's like, invite them into a meeting with a legislator, that kind of thing. Oh, my other thing that I forgot to say is that sometimes people who are advocates are so intent on what they want to say to a legislator that they come in and they kind of do this core dump or something, they kind of dominate and just, inundate the legislator. This is a working relationship. And if you don't know that legislator real well, you really want to be deferential initially about, we appreciate your meeting with us, and, we did a little homework and we see that you're working on several bills, around so-and-so, and give them a chance to talk. That's time well spent. They love to talk about what they're doing. We all do, and particularly legislators. So that's not time wasted. And I've been in meetings where, a legislator will say, oh, but I just came out of a committee meeting with my bill, and he's just, and it's about something unrelated to what we're talking about. And I can hear the drumming on the desk of the people that are in there. And later they're like, well, that was time wasted. And I'm like, no, he's going to remember us as a rapt audience. And we did have some time, we have to curtail them at some point and say, I know you don't have a lot of time, but we want to be able to talk to you about X. So again, just use your good social skills more than anything, even though they're legislators, even though they may not use good social skills sometimes.
I had a county representative recently say that, they so rarely hear from people when they aren't angry. So when they can have a pleasant social interaction with someone, it really does stick with them and it just makes them feel like a person,
Well, and that's the other thing. I have seen people that were really wonderful advocates just lose it in Frankfort. They were so mad at what a legislator said or didn't say or agreed or didn't agree, and they burned that bridge. And that you never want to burn that bridge. I don't care what people say to you. And they can say some god awful things about people with mental illness. Believe it, I think I've heard it all. And you just bite the inside of your mouth and say, I'm just going to keep on smiling, because sure enough, that's the legislator who comes through for you in another issue, or that you come back to another time. And you just really can never afford to burn those bridges. And sometimes our passion gets in our way, quite frankly, and people call. I always say when I do my training, with some groups, I'll say, be in touch with your legislators at home. Dr. Schuster did not say to call them at midnight screaming at them. Let's use some good common sense, because they're doing, the best that they can. And sometimes they're in a position where, they know that there's not much they can do about a situation.
I think that's a good note to end on. That reminder of what you said earlier was like, be polite, but be persistent.
Yeah.
So thank you so much for being here and for sharing all this with us. Yes. And thank you everybody for staying on a few extra minutes. There is a very brief survey to take as you hop off the Zoom. So we really appreciate your feedback, and we will be having more of these.
Grades, so I get paid a lot.
Yeah. We got to give Sheila the big bucks.
Yeah, that's right. Well, thank you. I hope to see you all in Frankfort at some point.
Oh yeah, we'll come pester people with you.
All right, great. I love that.
So, yeah. Nicely pestered.
Strategically annoying. Yeah. Thank you.
Yes.
All right.
All right. Thanks. Bye, everybody.
Bye-bye.